Hi, I'm here with Dave Tamburri, General Partner at Health Enterprise Partners. Dave, how you doing?
I'm doing great, Bill. Thanks.
Good. First of all, I want to say we're really excited. Rob and I actually am excited about our partnership with HEP. And I just wanted to ask you, because I know Rob and I went through a very long process in thinking about, when we're going to be taking on equity, who we should be taking it on with. What was your evaluation process? What did you see in us?
Well, Bill, first of all, thanks for the opportunity, and we are also very excited to be working with you and your team. And I think as we started thinking about the opportunity, we really looked at three issues. And one is we really like the fact that you have a founder finance team and you built a company from ground up with your own sweat and your own money and laid the platform for a fantastic culture that's focused on servicing the customer, most importantly. And that leads to a second point, which is we noticed that a lot of the customer acquisition strategy is a function of word of mouth, which means people are very excited about your value proposition. And then lastly, and perhaps interestingly enough, you really didn't need the capital. And we like to work with companies that are in a position to have a lot of options and to use this capital to best grow the business as they see fit and ride the market momentum you already have.
What did you guys know about this space, before really coming in contact with us?
Well, we probably spent 18 months researching broadly what we call the consumer engagement sector. And we believe, and even prior to health reform, that part of the way to improve healthcare is to have the consumer, the patient, more actively involved in managing his or her own lifestyle. And what we started looking at was thinking that traditional media doesn't have real proven ROI metrics that we could determine, and there had to be a better way of going one-to-one using digital means to acquire customers. And in doing so, we certainly think you have the most innovative and game-changing solution that's in the marketplace today.
That's great. I mean, we feel the same way, so it's definitely good to hear that you guys feel that as well. In regards to our volume performance management, that's a concept that we've been talking quite a bit about.
Sure.
We're introducing it with our clients. We're getting great traction there. Any thoughts on that as a kind of a front runner in terms of our kind of lead in to the product?
Well, I think it just spells out that this has an opportunity to create a category and to be the leader in it. And when I think about what you just mentioned, it really comes down to doing some very simple things. And that's connecting with patients, having them participate in or engage with the hospital for a service they want, and being able to measure that on behalf of the hospital, which is really innovative in today's marketplace.
As far as innovation is concerned, one of the things that we really feel strongly about it is our kind of riding this wave of cloud computing.
Sure.
and being, what we feel is first in the market space for our industry and around cloud computing. Thoughts about cloud computing in healthcare? How do you think that that's going to stick?
Well, I think it will certainly stick. I also think it's a new concept. And I think part of what you're having to do is educate the marketplace and also do it in two ways. One is how to use a digital means to acquire patients or consumers. And secondly, what does the cloud mean as part of that? And I think over time, hospitals will get more comfortable with that, but it certainly is on the front end of the learning curve, and you're helping change the marketplace as a result.
In working with a lot of organizations in healthcare IT, is there any other avenues you think that we might be able to go down, especially as far as healthcare reform is concerned?
Right. Well, one term that's often used is around ACOs, or accountable care organizations. And I actually think that eVariant has the platform to do a couple very interesting things. And one of them is connect the patient with the hospital system. Also to roll in either claims-based information or some way of measuring what's the cost associated with providing this care. And that kind of coordination lacks in the marketplace today. And I think you have the underpinnings to create a vehicle to enable this to occur.
As far as some of our vision is concerned about the target markets that we're going into,
Right.
We've had some great traction in with the academic medical centers,
Sure.
IDNs, and even community hospitals. We're starting to see some vision into the payer side as well as some of the
Right.
pharma side. Any thoughts on that and where we can go?
Well, yeah, I think that health plans will be in a situation with exchanges coming online in 2014 where they're going to have to develop one-to-one relationships with patients or consumers as they make choices about the health plans and coverage they want to have. And I think the platform that you have enables that to occur seamlessly and effectively in a way that can be measured. And that will become increasingly important.
We really feel like having experienced close to 12,000% growth over the past 3 years
Right.
is just an amazing thing that we've been able to do, and we're excited to be able to partner with you guys to help us, keep that momentum and keep going. So, I mean, as far as the future is concerned, we're extremely excited about working with you guys.
Well, we are too, and I think, one of the things I should have mentioned is that our investor base is comprised of 11 separate integrated delivery networks, and then 5 health plans and a large cardiology practice. All of whom are very excited about the solution that you have, in addition to some other folks we've been talking to in the marketplace. And that's how we vet ideas, as we go to the industry experts, we become customers, and the feedback we've gotten is terrific. And we're looking forward to help you and Rob grow the company, hopefully.
Yes, same here. Thank you so much.
Great.
Appreciate
Thanks.
it.